I kind of have a little checklist for dealing with that. Number one, you have to rule out the hidden painful medical issue they cannot tell you about. That's big number one. And acid reflux is probably the first thing you want to go after. Toothaches, earaches, yeast infections, urinary tract infections. You've got to rule that stuff out. And then the next thing is it's sensory overload. Did it happen in the middle of a busy Walmart? And then you need to maybe see the warning signs and get them out of that situation. So hidden painful medical, you especially need to look at that when you have a client who's been good and now all of a sudden it's bad. Then I'd look for hidden painful medical. Then sensory overload. The other thing is frustration because they cannot communicate.
Yes.
It's got to have a way to communicate. And then there are some individuals, and this is purely behavioral, they learn to manipulate with some of their fit throwing. This is where you've got to figure out, you've got to rule out the biology first and the frustration with not being able to communicate before you look at behavioral things like get at it doing something. I since my mind thinks in specific examples, I remember talking to one mom where she's or one worker who said that when the mom was driving towards McDonald's, the client would scream because he knew mother would stop. When dad was driving to McDonald's, he didn't scream because he knew dad wouldn't stop. Okay, that's an example of behavioral. What I've been able to figure out from all the talks and things I've given, all the conferences I've been to, kind of critical control points you need to rule out. And I'm just appalled at how often hidden painful medical is not carefully inspected and ruled out. I mean, you've got to rule stuff out. I've talked to several families where they just started using some acid reflux medication because that seems to be big number one. I have a certain amount of problems with acid reflux and it hurts. And that's the most common hidden painful. But then there's been weird ones. Years ago, I talked to a teacher and a kid had pushed a bean up his nose, and it rotted. And that, of course, would have caused behavior problems. People have died from appendicitis. But you've got to rule out hidden painful medical. Toothaches, earaches, urinary tract infections. Just all these common things. They're easy to check out.